Hi, I'm Erin Palmer, Team Racine Productions co-host and moderator.
And I'm Rebecca Loren, Team Racine Productions co-host and moderator.
Joining us is Brittany. Hi, Brittany.
Hi, thank you for having me.
Well, Brittany, before we talk about your book, please tell viewers a little about who you are.
Yeah, my name is Brittany Daniels. I am a Chicago native. I am a nurse. I am a former firefighter and a bit of an educator. And I'm really passionate about healthcare equity.
Great. Thanks so much. Tell us about your book and what inspired you to write it.
So my book actually started off as a journal that I carried with me throughout my day as a nurse. And, being Black and being queer, it really did and does shape the way that I experience encounters in the hospital and in the medical setting. So as a nurse, I wanted to be able to write down important things like passwords and passcodes and things like that. And then that sort of transitioned into a way for me to decompress after a long shift or to really reflect on the encounters that I experienced or witnessed throughout my day as a nurse. And that's really where my book came into fruition for me, is realizing these stories must be told in order for folks to understand what really goes on within the walls of the hospital.
What was unique about writing about being a nurse during the COVID pandemic?
COVID-19 was interesting for me, especially being in the emergency department. We were in a place where folks didn't want to come to work because they were afraid of losing their lives. They were afraid of not being able to care for their children. They were afraid of getting their families sick. So we were short-staffed, and the number of patients that we saw per day fluctuated. At first, the numbers were low because everyone was staying home with the stay-at-home order in place. And then we started to see these rehab facilities get hit with COVID and these nursing homes get hit with COVID. And that's when things really started to just explode within the emergency department, to the point where, we would have more than one patient coding or in cardiac arrest at the same time. And so we would be arguing or trying to figure out, who do we need to give the defibrillator to at this moment, because we have 3 people that need it, but we only have 2. Parts of the country were running out of oxygen and things like that. So it really was just all hands on deck. It was exhausting. It was emotionally draining, knowing that people were passing away in the hospital and they couldn't have their family at the bedside with them. And at the same time, we were witnessing some really serious racial injustices take place. And so we were witnessing the death of George Floyd, the death of Breonna Taylor, and that was really impacting the way that we were communicating with each other and the way that we were working together, because there was a divide.
Wow, Brittany, you're talking about a lot of things that people are not aware of, which is needs to be talked about. So going down that lane, what do you hope readers learn from your book?
Honestly, I hope that readers understand after reading my book that everybody has a story. Everyone's story is different. We can't assume what people's stories are. We can't assume how easy it is for some people. And I really hope that people take that away, that everyone's story is unique to them, and that makes them who they are, and it changes the way they experience things in life.
Your book touches on the big issue. First of all, let me name your book, Journal of a Black Queer Nurse, so that's clear for everybody listening. But your book tackles a big issue, which is racism in the medical profession. And I'm wondering if you can talk about what it was like to write about something so big from your personal perspective.
It was liberating to be able to write about it, because racism in healthcare doesn't simply impact the person who is being treated poorly or not being treated because of who they are. It impacts everybody around that person. And so when we're talking about someone who's being denied pain medication because of the color of their skin, or because of their tattoos, or because of their demeanor, or because they don't speak English, that impacts them, of course, but it also impacts their care team. So we take that home as nurses, as ER techs, as doctors, when we see that. And especially when you look at medicine, there's a hierarchy, right? There's the lead doctor, there's their fellow, there's their resident. So there's always someone in charge, and there's always someone underneath that person. And people are afraid to speak truth to power in situations like that because they're afraid of losing their job. They're afraid of retaliation and things like that. So for me, it was liberating to write these stories. It was liberating for me to live these stories, because I am not afraid to speak truth to power, and I am not afraid to advocate for people, because at the end of the day, that's what they deserve.
Incredible. Can you tell us about how your book has been received and some of the feedback that you've gotten?
Yeah, most of the feedback that I've gotten is, wow, I can't believe people can be so cruel, right? Or I can't believe you experienced that in real life. I thought that that was just in movies or in TV, and people don't realize that this is very, very real. And, most of the responses that I've gotten are just pure surprise or shock of the experiences that I'm sharing, and others are not surprised whatsoever. It all just depends on the person, what they look like, what they've lived through. And it seems like it's doing pretty well. It seems like folks are getting the message.
Brittany, that is awesome. You're like, again, you're speaking on some real topics. Like, we've always heard about these things, but to hear somebody, especially in our time, to speak up is extremely important. So what are some upcoming promotional events and opportunities for people to interact with you, some of your readers to interact with you?
Yeah, I'm actually going on a short tour in June this year, two weeks, I think. In June 23rd, I'll be in New York City. The 24th, I'll be in Philly. The 25th, I'll be in Baltimore. And the 26th, I'll be in DC. And I have all the information on my website as well as my social media. I'm really, really excited to have these conversations. I'll also be speaking at TravCon this year, which is a huge nursing conference in Vegas. That's in September. And then I'll also be in Seattle for the Seattle Town Hall in October.
That's great. And we look forward to welcoming you in DC and having you share your work with us here. Where can our viewers find your book? How do they get it into their hands so that they can read it? Where can they learn more about you and what's upcoming? How do people stay in the know? And most importantly, get your book in their hands?
That's a great question. So my website, blackqueernurse.co, is a great way to get in touch with me. It's a great way to stay up to date on where I'm at, what I'm doing. My social media is always up to date as well. It's always current. My Instagram handle is black_queer_nurse. And my Twitter is blackqueernurse, one word. I am always open to questions, conversations. I really love people, if you can't tell already. And the book is available via Amazon, all bookstores. Support your local bookstores. Please support your Black-owned bookstores. Please support your queer-owned bookstores. But if all else fails, you can go to my website, and that links directly to my publisher, Common Notions, who I love.
Awesome. Viewers, please look in the description below for links. Brittany, thank you so much for doing such a powerful thing and just for sharing what you're doing with us. We truly are grateful to have you here. And yeah, thank you guys so much.
Thank you. Thank you.
To those watching, please follow Team Racine on social media and subscribe to the Team Racine YouTube channel.
And viewers, thank you for watching.